Hey guys, Zach here with the Kennedy Report. I know it's been a few days since we got a video out, but unfortunately we've been dealing with some censorship issues once again. Facebook has delisted us, we can no longer have advertisements, and just in general getting our content out there is going to be harder than ever before. Additionally on YouTube, the algorithm has gone against us and we've seen a complete plummet. And unfortunately, it's up to us now to combat it. So if you find this information that we've been putting out there the last couple weeks useful and accurate, please give it a like and a share, because it is up to us to share information with those around us so we can better protect the population. So on that note, I want to go ahead and say thank you again for your continued support, but let's go ahead and get into this. The coronavirus is here in the United States, and we are just now at the beginning of our epidemic. As I've been saying for several weeks now, you need to be prepared. The time to have prepared has technically passed, but it's better late than never, so please hear this information out first and then plan accordingly. So let's go ahead and get into the news. We have 78,500 confirmed cases roughly around the entire world right now. Majority of those, we're at over 80,000 around the world. We're looking at the China details currently. So in China, we have 78,000 confirmed cases and nearly 3,000 deaths. Now keep in mind, confirmed cases is very different from actual numbers, okay, because these are people who have been tested and confirmed. That's a lot. The numbers are far greater, and we have a case study now coming out today that estimates that in Wuhan alone there is 1 million infected people. Not Japan. China has been greatly underreporting deaths and infections. That's just always been a thing. In a country full of 1.6 billion people, they claim only 67 people die from the flu a year. Okay, that's not possible. It's just the Chinese healthcare system is terrible, and at the same time, they don't report deaths like most Western countries. Okay, so let's go ahead and get into this. South Korea, right now, second largest host of the coronavirus in the world with 13 deaths and almost 2,000 cases. Now, I don't believe this is actually the second worst nation at the moment. I believe Iran is currently undergoing a massive epidemic, because it's local to them, but I mean, obviously it's a pandemic around the world, but specifically in Iran, there are massive amount of information coming out of Iran that talks about how there's a lot of people dying and a lot of people sick, and I mean, for example, the vice president of Iran has been confirmed infected with the coronavirus. The deputy health minister of Iran has been confirmed with the coronavirus. The video evidence and the local information coming out is very limited, like in China's case, but Iran's actually more totalitarian with the information coming out of the country. But we got some video evidence. Here's a video coming out of Iran right now. No one wearing masks. Poor girl. I got more. I gotta kind of dig through it here. Forgive me. I should have had this a little bit more prepared. There's just so much stuff coming out right now. I'll look for it here in a minute. Here in a bit. There it is. Okay. Another guy, this is at a airport in Tehran, okay, in Iran. And as you can see, another gentleman passed out. This is just early on coming in. We know that Iran is undergoing a massive breakout. You do not have some of the upper tier politicians. This infection. We had that mayor we talked. Oh, that's right. That video was taken down, so you guys didn't hear. The last video I tried uploading talked about Iran specifically, and I think it's because of the religious context that the video was taken down on two platforms. In Iran, there was a town where the mayor was confirmed infected, and the day before he had tested positive, he had been at mass, whatever it's called. He went to the temple, the shrine, and he was with 1,000 other people, very close proximity. And then upon completing their ceremony, basically they did the traditional kissing of the cheeks and hands, and definitely spreading this around. So potentially 1,000 people alone in that situation affected. This was last week. It sucks to have to kind of go back and cover information that I've already covered, but it's been a while for you all. Excuse me. 26 deaths confirmed in Iran. Some doctors are reporting Iran a death every hour, so these numbers may not be accurate. Italy, 14 deaths, 528 cases, 40 recovered. Italy is currently undergoing a epidemic as well. And others. Japan. So the Diamond Princess cruise ship is no longer a thing. Everyone has been evacuated, but of the people on that ship, 705 of them were infected with 4 deaths, only 10 recovered. All in all, as our time has gone on, this map has gotten bigger. Now, one of the biggest news that I can report to you today, and it's not good news, we do have a confirmed case in Brazil, okay? That is concerning because Brazil is another massive population center. This is on every single continent on planet Earth except for Antarctica. So good for the penguins and stuff that live down there. Not so good for everybody else. Africa may be quietly undergoing a massive outbreak itself. We do have a new case reported in Algeria. Sri Lanka has a new case. Quite a few new countries are popping up. As you can see, most of Europe is now inundated with cases. Finland, Norway, Sweden, United Kingdom, popping up all over. It's not looking good, guys. So that's why now is the time to start preparing. You need to be taking all your actions. I'm not saying go and hoard everything, but you need to be prepared. Some new news coming out right now is Japan is planning on closing all schools for up to a month. Every single school, grade 1 through college, okay? No one going to school. This is a tremendous action taken to further prevent the spread of the virus. Okay, really no point going in here because all these cases are so small. A lot of these I don't think are going to be accurate. I don't believe Cambodia is not experiencing some small one case with one person recovered. I believe that they currently have more. I also believe that North Korea is currently undergoing. In fact, there's no way. China has hundreds of people going into North Korea every day, if not thousands. And I just do not believe for one moment that they're not having outbreaks in North Korea. If we can find our new videos here. That's one. Okay, well, we'll go ahead and go to the next resource. Okay, estimated, these are papers from medRx. I want to say these are not peer-reviewed yet, but it's still important. What is this one? Ah, okay. Forgive me. This is talking about the infection rates potentially in Iran. They believe that there are currently 19,000 cases roughly of the coronavirus in Iran, with a very low rate of being able to effectively treat the disease. Very interesting. Okay, so I will have a link to this paper in the description of the video, either on YouTube or Facebook, and I would recommend reading it. So basically, we have cases popping up all over the Middle East originating from Iran. We do not have a way of knowing how long it's been going on in Iran. There is estimates that in Italy the infection has been going on for 3 weeks, yet we've only known for a week now. Probably does not help my situation drinking a soda while trying to do a live video. Breaking. Prime Minister Abe has asked all elementary, middle school, high schools nationwide to close starting next week. Okay. One of the reasons why I used archive websites instead of the actual websites, one, it does not show the ads, and two, it is a way to deprive these media corporations of their income. And I do that because I am holding them directly responsible for most of the censorship that is occurring across the internet, and also just in general, their failure to report the news accurately and on time and just give people the raw information. So that is one reason why I use archive that, and two, it can't be taken down and or changed without us knowing. All right, a woman tested for coronavirus again, test positive. Okay, so what is going on? We're having this in Osaka Prefecture, Western Japan, and in mainland China. We are seeing many people reinfected with the coronavirus. We don't know how they're getting it. Maybe it's just like they recover and they get it from the hospital while they're still there, or the virus may be living on surfaces in their homes or wherever it may be. However, this woman is a tour guide living in Osaka. She was on the bus carrying tourists from Wuhan, and she has basically been reinfected with the coronavirus. Now, this is where I'm going to be very interested in seeing the data on. I want to know what the complication rates are with people who have been reinfected with the coronavirus. I want to know if there was a semiology or immunology put in from the first time, if the body has actively now got defenses against it, or the antibodies, if you will. Because some information indicates that the second time you get it, it's far more deadly, but we don't know. We'll find out. 14% of those recovered from the coronavirus in China's Guangdong province is tested again positive. Again, so this is kind of following up on the last thing. The Chinese Center for Disease Control is saying that they're having massive issues with people being reinfected again. And some people say that this is where we're seeing the videos of people dying from, I can't ever say the word, but the viral heart infection. Let's go back over to our map real quick if I can find it. We have video evidence right now in northern China. Okay, so real quick, the cases reported in China have drastically ceased, including the deaths. They just have not been going up or moving. And obviously this is a control flow of information. I think China is wanting people to get back to work, get the factories open again, because the supply chain is about to get nuked. I mean, in the sense that we're running out of shit. We're talking 20, 30 days left in stores here in the United States for Chinese-made products to be replenished. Those factories haven't been open for almost a month and a half now. The break from Chinese Lunar New Year ended 3 weeks ago, so that supply chain should have been restored. Supply should already be on boats coming across the sea all around the world to feed our global supply chain, and that's just not happening. But anyway, back onto the subject. Harbin, China, right? So if you see here, no reported cases in Harbin, China, just north of it. Got Heilongjiang, we had 480 cases, and we had Jilin, mainland China. Okay, Harbin is the 9th largest city in China, and it is kind of in northern China, very northern. As you can see here, it's kind of close to the Russian border. Harbin has been put on lockdown. There are video evidence of the entire city being surrounded by local police and military from China telling people to turn around in both directions. So if people are trying to leave Harbin, they're being told to go back. If people are trying to come into Harbin, they're being told to go away because there's been an outbreak there. Yet we have 0 reported cases showing up in the data from China. And this has been going on for a week now. So again, we can tell that the Chinese government is clamping down on information. I think they're just trying to get people over this whole thing and just get back to work and deal with the situation as it occurs. I think another real reality that we need to consider here is that China has been grossly underreporting the death rates from the virus. I'm sorry about all these background sounds. I'm getting information in from other sources. That's another thing. I have some wonderful sources from inside China now. I have close to 6 different people now giving me information, videos and photos, and just wonderful resources. And thank you. If you have information you want to share with me, please send it to me. You know how to get a hold of me via Facebook. Now, on that note as well, Facebook is the best way to get up-to-date information. YouTube, I only upload these videos to, but on the Facebook page, we have news stories, we have articles, and we have little clippets of information that we can share on the dime as it comes in and translate. So Facebook is your best bet for information, and I highly recommend that you like and follow on there if you're interested in this content. Let us go over here. A 29-year-old respiratory doctor, Peng Yinhua in Wuhan, who delayed his wedding to continue working, died on Thursday. He contracted the virus and was admitted to the hospital on the 25th of January. So we are now the 27th of February, and he just now died on Thursday. Today, the 27th. So over 30 days fighting this virus, and he died the other day. And he is so young, 29 years old, and he was passed away. So again, this virus can kill anyone at any age. And considering he was a doctor, you know he was healthy. He was getting what he needed, and he still succumbed to the virus. And he was probably getting the best care too, because, you know, you need to take care of the doctors in this situation. Okay, early epidemiological assessment of the transmission potential of the virulence of the 2019. Okay, so this is the paper we were talking about that puts the R0 at about 6 to 8. And basically saying that the infection rates in Wuhan City alone is closing in on 1 million people. It would match the information that we're getting out of China. I mean, from the private streams, not from the Chinese government, because of course the Chinese government lies about everything. Just absolutely crazy. Again, MedRx, we will post these links in the... Everything you've seen in this video will be posted in the description. Great reads, okay? We're constantly getting medical papers out, and they're great resources to get information from. Okay. Okay, so here's another story from Reuters. One lady has spent 2 weeks waiting for the results of her coronavirus test. Now, many people who are infected with the coronavirus in China who go to the medical facilities to get tested, they have to wait 2 to 3 weeks to get their results, and in that meantime, they're kind of, you know, shit out of luck. In China, in order to get admitted to the hospital, you need to have a confirmed paper that says that you are infected with the coronavirus, and then you have two options: get quarantined at one of the camps or quarantine in your home. And depending on your medical needs, you need to have like 2 more documents filled out to even be put in a hospital and have a bed, because they're very limited space and people are dying. We have shown videos. I mean, I'll show it again because it's important. Again, we upload these on our Facebook. We don't upload all the videos up to YouTube because YouTube would just take them down. What is this one? It's an older video. Just them welding people into their homes still. Sorry, we have a lot of videos. I mean, I have hundreds, and I'm terrible at keeping them organized. Here's a video of the... Oh, that's one where I actually did not properly record it.
做好14天居家隔离健康观察，协助村社区或物业管理公司对居家。
These are people returning back to the cities to work in the factories, and unfortunately, they're not being able to get back in. A lot of them. So in China, a lot of people disappear for Chinese Lunar New Year, return to their homes. They leave the big cities, the factory centers, and they go back home. Now many of them are returning, and they can't get back into work because many of them have remained closed. We have illegal black markets for farmers are popping up. This is not supposed to be occurring in China right now. These little markets are popping up all over China where people can still get their groceries because the farmers are pissed. A lot of them have crops that are rotting away, and that's money. If anyone here is a farmer, they know they don't make a lot of money. They put all their investments into the crop, and if they do not get it to market, they're in trouble. Plain and simple.
大家都看看，这都是上海的厂，都是套路，都是坑，来了也进不了厂，钱也花完了，口罩也用完了，家也回不了，都不要来了啊！上海的厂都不要来。
Okay, so what's going on in this scene here is she is outside of the factory in which she works. She said she showed up for work today, and unfortunately, they are not letting people back in right now. Very limited, and it is a slow process because everyone who is going in is being checked. We have video evidence of mass police arriving in Wuhan. So, again, I look at the actions, and this is how I've been able to conclude a lot of the information I have been. I look at the actions that people take, not as opposed to what they say. When you see that the infection rate has supposedly dropped, and it's actually going down every single day, in, say, cities like Wuhan, but you see a large police presence being shipped in from around the country, put two and two together. Okay, I don't think it actually has halted. Now, sorry, this is the video we showed at the beginning from Iran. We do have, okay, so this is an interesting one. I'm trying not to have this video be too long.
How many face masks do we have?
We currently have 30 million N95 respirators in the Strategic National Stockpile.
How many do we need?
Dr. Kadlik mentioned to the Senate this morning needing approximately 300 million for healthcare workers.
What's the mortality rate of the coronavirus?
It's showing right now anywhere between 1% and 2%, but again, that's based on a denominator. There may be many, many more cases in China that are low symptomatic or haven't secured treatment and hence aren't in the Chinese reported
What's
cases.
the mortality rate of influenza?
Seasonal influenza tends to be 0.1% mortality.
Okay.
Did you stockpile any?
Real quick, I want to pause it at that. 0.1% mortality rate for seasonal influenza. 0.1%. Okay? I still am having arguments with people that this is not the seasonal flu. 2 to 5% case fatality rate with the coronavirus is significantly higher than 0.1. That is 20 to possibly 25 times more deadly. And that's not if the strain in Iran is not different. We need to get the information on the strain that's affecting Iran right now because the death rate seems significantly higher. We don't know if that's just because of poor healthcare or because of the virus changing. Okay, it's just frustrating. But let's get back to this.
These critical supplies that we are told we need: masks, protective suits, ventilators, anything, is that stockpiled and ready?
So we do have in the Strategic National Stockpile ventilators, we have masks, we have...
Enough?
Well, of course not, or we wouldn't be asking for a supplemental to seek more money to procure.
Okay, so as you can see from that, this is Congress, Senate, basically saying they do not have the supplies they need. 30 million face masks is what they currently have in the strategic stockpiles. They need 300 million for healthcare workers alone. That's not the general population. Okay, that's healthcare workers alone. Additionally, they do not have the respirators, the breathing apparatuses that they need, and oxygen tanks that they need. They're asking for $2.5 billion to make that possible. And yeah, that's all I've got for you so far on this video. We're going to continue to post information as it comes up. Again, please go to our Facebook page, follow it, like it if you can. It is where you're going to get the most information. And frankly, YouTube is getting so frustrating to deal with at this point that I don't even want to deal with it, but I still will upload the videos when I can. Facebook is just, and believe it or not, Facebook's giving me issues too, but it's just easier for me to get information out to you, and it's as simple as that. I don't really care about, I just want to give you the best information I can. And I hope this video was somewhat useful to you. Understand that things are getting far worse. We have outbreaks in California. We had today, like, the CDC's first confirmed unknown origin case. So somebody, community infected. And I think this is the beginning for the United States. So be prepared. Go get your food, get your water, be able to stay in the house. Japan's taking massive actions to prevent schools from opening to help prevent the spread of the virus. China quarantined the largest amount of people in human history. Okay, these are actions taken by governments that are not normal for the seasonal flu. You do not see entire countries shutting down over the seasonal flu. So stop comparing it to the seasonal flu. And if you hear anyone compare it to the seasonal flu, use the information you've heard here because it's backed and proven that it's far worse than the seasonal flu. 20% critical care rates currently. Okay, that's with the best care possible. And the deaths, 2 to 5% possibly. Thank you guys. This is Zach with the Kennedy Report. Have a wonderful day.